My name is Doug Burgoyne. I'm the president of Veridicus Health, which is a pharmacy benefit management company based in the United States. GRIP is the Global Respiratory Infection Partnership. It's a worldwide organization that has a mission of reducing inappropriate antibiotic utilization, providing toolkits to prescribers and to patients so that they can improve the symptomatic relief of upper respiratory tract infections. Because GRIP is a global organization, I'm fortunate enough to participate as the U.S. representative. Not only do I get to represent the United States, but also managed care. As the past president of the Academy of Managed Care Pharmacy and as one who works in the pharmacy benefit management world, I'm able to represent managed care companies within GRIP. GRIP can make a difference in relation to antimicrobial resistance through the 5P framework, where really the patient is in the center of care, whether the pharmacist is involved or the physician or policy and prevention. But really we need to have a patient-centered focus so that they're the ones that are receiving care and seek appropriate symptom relief as well as care down the road. The GRIP 1, 2, 3 approach is pretty simple. Number one is to address patient concerns. Number two is assess the patient for red flags or need for appropriate antibiotic therapy. Number three is address self-management opportunities. Or is there an opportunity for a patient to care for themselves instead of receiving an antibiotic? There are lots of extenuating factors that influence antibiotic prescribing in the primary care setting. One may be a person who really desires to get back to work quickly and thinks the antibiotic is the magic bullet and places high demand on the physician. The other is a young person who is in daycare and mom and dad need to go back to work and the daycare won't let them return until they've been on antibiotics for 24 hours. Frequent travelers often demand antibiotics from their prescriber. So there is extreme pressure on the prescriber to give antibiotics to patients. The GRIP toolkit can help physicians teach their patients about appropriate antibiotic use and symptom relief so they don't need always to walk out the door with an antibiotic. The conversation between a physician and a patient has got to be a tricky one for the physician. Think about it. Here you have a customer that's asking you for something and you want to help them. You've been trained as a physician to prescribe something, to give them some type of healing, yet you know that what they need the most is time and symptom relief. So that relationship is key. Number one, patients go to their doctor because they trust them. Doctors need to take advantage of that trust, frankly, and teach the patient as they're going through their exam about the signs and symptoms of viral infections versus bacterial infections and set the groundwork for the discussion about appropriate use. In that critical conversation, the physician can change the behavior of the patient in the long run. Even patients that know about antibiotic resistance will sometimes talk to their doctor and ask them for a prescription. What they really need is self-management earlier when they start to experience symptoms. It's surprising. We sometimes forget. We just think, oh, I've got a cold, it'll go away in a couple of days. In a couple of days it doesn't. So why not start the symptomatic treatment earlier? HCPs can improve their own education about antimicrobial resistance as well as help educate their patients by using some of the GRIP tools that are available to them. Some of those tools are pretty simple. It's a poster that goes up in the exam room to help them teach the patient. It's a leaflet that they can give to the patient to take home. The GRIP toolkit also includes information for the physician and the prescriber, whether it's continuing education or personal development about antimicrobial resistance, but also leaflets that they can give to their patient. So the patient doesn't walk out empty-handed from the doctor's office. Instead, they walk out with a plan to treat their symptoms.